You know, you don't usually think of official documents as being, well, exciting. But sometimes, hidden inside, there's a really powerful story. We found one of those in the clinical journals of a nursing student. It's a tale of 4 clinics, and it reveals the very essence of what forges a great nurse. So we're going to dive in.
So let's start with this question. What's the real difference between a day that actually builds a nurse up and one that, well, just wastes their time? It sounds simple, but the answer has huge implications for the quality of healthcare that we all get. This is really the core of what we're exploring.
And you know what? We found the answer right here in the clinical validation forms of a student named April Roberson. Over just a few months, her experiences, the good, the bad, and frankly, the boring, paint this incredibly vivid picture of what truly works and what really fails in nurse training.
All right, so first up, let's look at what happens when things go right. This is care at its best. These are the experiences that didn't just teach April, they inspired her. They cemented her whole reason for being there. Just listen to this quote from her time at New Beacon Hospice. It says so much. You can just feel the connection she made, right? She saw with her own eyes that the environment is a huge part of care, that patients are more comfortable in their own homes. This is what human-centered learning actually looks like. So, what was the secret sauce? What made her time at the hospice and the Wylam Adult Day Care so good? Well, it really boiled down to a few key things. She was doing hands-on work, not just watching from the sidelines. She had direct contact with patients. She was trusted by her mentors and given the space to work on her own. And maybe most importantly, she felt helpful. She felt valued. And just so we're all on the same page, this is what we mean by clinical experience. It's the bridge between the textbook and the bedside. It's where all that theory becomes real-world practice, and it is absolutely 100% essential.
And this quote, man, this just hits the nail on the head. Listen to what she said about her time at the adult daycare. I also felt like a real nurse. That feeling doesn't come from a lecture. It comes from being given real responsibility. Trust and autonomy aren't just nice-to-haves, they're the ingredients that turn a student into a professional. But that feeling, well, it wasn't going to last.
Okay, now brace yourself for the whiplash. Listen to this. At Trinity Medical Center, her reflection was the complete opposite. I didn't really do anything. After feeling like a real nurse, she was suddenly on the sidelines feeling totally useless. The difference is, wow, it's just jarring. So that brings us to the other side of the coin. What happens when training just completely falls short? This is when the opportunity for learning gets squandered, and it all becomes about just getting through the day.
What's interesting is that April's bad experiences weren't all the same. They basically fell into 2 different buckets. At Trinity, it was just institutional neglect. The nurses were swamped, so she got pushed aside. At a Pediatric Obesity Forum, the problem was poor pedagogy. In other words, just bad teaching. The info was good, but the delivery was so passive it just didn't work. Think about this. At Trinity, she was on site for a full 8-hour workday. 8 hours. And for those 8 hours, what did she get? This chart says it all. 8 hours logged, and she saw just 2 patients. That huge gap you see, that's a day of education just gone. This wasn't a learning experience, it was a waiting game. And if you want to know how that felt, this quote, it's just heartbreaking. They gave her a book to look up cancer drugs, not to learn, but as busy work. She said it was just a way for the nurse to get me out of her hair. She felt like a burden, not a future colleague. That's just so demoralizing. Okay, so what about that other bad day, the forum? Even though she said the information was useful, the format completely killed it. Her final verdict was simple. The presentation was too long and boring. She gave it the lowest recommendation possible. It's a great reminder that even good content is useless if the delivery isn't engaging. Passive learning just isn't learning. So this all begs the question, right? Why is that active hands-on experience so incredibly crucial? Well, because it's what lets a student do the real deep mental work of nursing, connecting what they see with their own eyes to the huge body of medical science. Okay, check this out. This table from her hospice report, this is where the magic happens. She observes a specific risk factor like impaired skin integrity.
Then she connects it to the bigger aggregate problem, that bed rest hurts circulation, and then boom, she comes up with a concrete nursing action: turn the patient every 2 hours. This is the mental muscle that a good clinical experience builds. You just can't get that from a boring presentation.
All right, so we followed April through 4 very different days, the good and the bad. So what's the big takeaway here? What's the secret ingredient that really truly makes a nurse?
When you lay it all out, it's pretty clear there are 2 totally different paths here. On one side, you've got effective training. It's active, it's human-centered, it's respectful, and it builds independence. And on the other side, you've got the exact opposite: passive, impersonal training where the student is sidelined and kept dependent.
And I really want to stress this. The difference we're talking about, it is not just about having a good day versus a bad day. It's about what kind of nurse a student is being empowered to become. Are we building confident, competent professionals, or are we teaching them to just feel like a burden and stay out of the way?
You know, April Roberson's story, hidden away in these simple forms, really gives us the blueprint for both success and failure. And so it leaves all of us with a really critical question. Since a nurse's education is the absolute foundation of our healthcare, how do we build a system that makes sure every single one of these days actually counts?